And we are moving right along in the nervous system. We are on topic 3, reflexes. And again, if you are not yet subscribed to my channel, what are you waiting for? Take a minute and do that. Like this video, comment if you have questions. All right, so today's topic is on reflexes, so let's get started. So many of us don't think about reflexes beyond maybe when the doctor hits our knee with a hammer when we go for our physical, but there's a lot more to it, and there are far more reflexes than that. So hopefully after this lesson, you'll have a deeper understanding of reflexes and some things that they can indicate when there are problems. Okay, in class, I would show this video. We're going to skip past that, but I will link the video below in case you want to watch it. This is probably the reflex we are most familiar with, the patellar reflex or the knee jerk reflex. It does help to keep our balance when the patellar tendon is stretched. So when it's hit with the hammer with enough force to stretch that tendon, the quadriceps muscle, remember on the anterior part of your thigh, are going to contract. And when the doctor hits the patellar tendon to make it stretch, that is the reflex they're looking for. So what is a reflex? It's an involuntary action to a stimulus. It happens almost instantaneous. So how does it happen and why is it so fast? Well, it happens through a pathway called a reflex arc. It allows the response before the impulse reaches the brain. The impulse is still sent to the brain, but our body reacts before our brain is able to perceive and interpret. Why? What does it look like? So first, a stimulus. In this example, touching a pin, okay? That stimulus activates a sensory neuron, okay? And remember, since it's sensory, that's the dorsal root. It's going to go to the spinal cord and through this interneuron right here, okay? So right here, this interneuron right here in the spinal cord is going to connect to the ventral root, okay, or the motor neuron, and send a signal out. And right away, the response is going to be to move your hand away. But at the same time, so you can see right here again, here was that interneuron within the spinal cord, and this happens instantaneously. So signal goes down. Let's just switch the color. That's a little hard to see. So the signal goes down the sensory neuron through the interneuron and then down the motor neuron real fast. But at the same time, the signal is also sent through an interneuron that goes up to the brain. So our body will eventually interpret that signal, but it doesn't happen before the response. Okay, so again, here just really quickly, you can see our brain has to be involved for the decision-making process, but in a reflex arc, it is just going to be real rapid and only involve the spinal cord, not the brain. All right, so again, in class, we're going to watch this little video about newborn assessment. I'll link the video below if you'd like to watch it. But let's look at some of those newborn reflexes. So the Moro or startle reflex, and I tell you about what age it's present until, but you won't be required to remember that. And what it results in is abduction of the arms, then adduction of the arms, and then usually a startled look or cry. And it's in response to thinking that the baby is falling. Sometimes, though, they do this just naturally when they're sleeping, which, fun fact, this is why parents swaddle their babies so that they don't startle themselves awake, okay? And then we have the rooting reflex. So what happens is when you touch a baby's cheek or close to the mouth, they will rotate their neck and open their mouth in the direction that they're being touched. So touch them on this side, they turn their head this way. Touch them on this side, they turn their head this way. And then the sucking reflex. The sucking reflex develops in utero around 32 to 36 weeks. So babies born prematurely before 36 weeks may not have the ability to suck correctly because the reflex literally hasn't fully developed. And what happens is when the roof of the mouth is touched, the reflex from the baby is to begin sucking. It lasts again until about 4 months, but again, I'm not requiring you to know the ages. So here you can see the rooting reflex. When that baby's cheek is touched, it turns its head and opens its mouth toward the direction it was touched. The stepping reflex. If the soles of the baby's feet touch a flat surface, the baby will walk, move its feet. Obviously, it cannot support its own weight, but it will perform the walking movements. And this reflex somewhat returns around 12 months as babies do learn how to walk. Okay, so here you can see with soles flat on the ground, the baby moves its feet as if it's stepping. And then the palmar grasp reflex, stroking the palm, causes the baby to close its fingers and grasp. Very young babies sometimes grip very tightly, almost seems like they could hold themselves up, but don't do that. They literally let go sporadically with no rhyme or reason. So here you can see the palmar grasp reflex. And then we have the tonic neck, also called the fencing reflex, and that's when your head is turned to the side, okay? That arm, that side will extend straight out and the other side will be flexed, okay? And that is a typical fencing pose. So you can see the head is facing this way, so that arm is extended and the other arm is flexed. And sometimes it occurs in both the arms and the legs. And then the plantar grasp reflex is similar to palmar, but it's going to be with the sole of the foot and the toes. Okay, so pressing the sole and the toes flex and grab. Okay, now reflexes can also be tested in adults, and I'm not going to show this video here, but I will link it below in case you would like to watch it. So let's look at some reflexes that might be observed in a neurological exam. So we have the Hoffman reflex. So how is it tested? So with your hand like this, you're going to flick the nail on the middle finger downward. Normal in adults, nothing happens. The abnormal response, so the Hoffman sign, is that the index finger and thumb will flex. Now, it doesn't mean they will go completely like this, but there will be some flexion. Normally, nothing should happen when you do that. What can it mean? It can mean a brain tumor. It can mean multiple sclerosis. It can mean a spinal cord injury. So here's what it looks like. Watch. Flicking that finger is going to cause some flexion in the index finger and thumb. Again, it does not cause them to close all the way, but you will see movement. Now the Babinski reflex. Lightly scratching the sole of the foot. Okay, so not a press like with a newborn who's going to have that plantar grasp, but stroking the sole of the foot. So in normal adults, the toes are going to curl down. In children, until around age 1, the toes are going to curl up and fan out. But if the toes curl up and fan out in an adult, it can indicate stroke, a brain tumor, meningitis, or a spinal cord injury. So here you can see the Babinski reflex. Okay, in an infant, you can see the toes fanning out. You can see normal reflex in an adult. The toes curl, flex. And then the Babinski sign, the abnormal sign, where those toes fan out like in an infant. And the snout reflex, so lightly tapping the upper lips when your lips are held together. Normal adults is no response. Babies, maybe until 6 months, their lips will pucker. Think about making a snout face. What can this mean if it's seen in an adult? It can be a frontal lobe issue. It could be trauma or stroke. So here you can see in the baby, pressing on tapping the upper lip results in that snout face. Normal response in an adult, as you can see demonstrated here, should be nothing. There should be no puckering. Now the glabellar reflex or Myerson sign. So you lightly tap the glabella. What is the glabella? If you didn't know that, that's the area of the forehead above the bridge of your nose and between your eyes. So right around here. So you're going to tap it. Normal response is to blink, but typically stops blinking after a few taps. If the blinking persists, it can be a brain or abnormality, and often it is a sign of Parkinson's disease, and that's why it's called Myerson sign. So you can see in a baby, tapping left glabella is going to cause blinking. Tapping for Myerson sign, that blinking should cease after a few taps, but you can see in this GIF that blinking does not stop, it continues. And that is, again, Myerson sign, often an indicator of Parkinson's disease. And then the palmomental. So palm, mental, chin, not mental thinking. Okay, how is it tested? You're going to scratch the palm of the hand. And usually it's in this area, the thenar region, which is like that pudgy part here at the base of your thumb. Normal response is nothing. At birth, sometimes the chin quivers, so that's contraction of the mentalis muscle in some children who have Down syndrome. If it's seen in an adult, it can be frontal lobe damage and often an indicator of Alzheimer's disease. Okay, so how do you provoke the palmomental reflex? Again, you're going to brush the thumb on that thenar, that kind of squishy skin here at the base of the thumb, and you can see if the palmomental reflex is activated, the chin is going to quiver. Okay, so you're going to see movement of the chin and lips. That should not happen unless there is an abnormality. And then the cremasteric reflex, how is it tested? It's going to stroke or pinch. Pinching is sort of a mean way to do it, but the medial thigh of someone who has testes. And the normal response is the cremaster muscle contracts and elevates the testes. If it's absent, it could be damage to the brain or spinal cord, or it could also be testicular torsion. So again, it's going to be stroking. It doesn't matter what direction, meaning superior or inferior, but the medial thigh. And then normal anatomy does not have twisting of the testes. You can see testicular torsion, that is twisting. So if the cremasteric reflex is absent, it could be indicating testicular torsion or something wrong with the brain or spinal cord. And there you have it. That is what we're going to cover with reflexes. So I hope you learned something.